Afternoon and welcome to the SBAM Daily Brief. It is Wednesday, April 22nd. This is the 31st day of the daily briefing that we've been doing, really just an effort to try to help Michigan small businesses, all of them, navigate this COVID crisis and survive this COVID crisis. It is day 30 of the Stay Home, Stay Safe executive order and 8 days until May 1. And I'm going to start sort of counting down, not that we think something magic that is going to happen on May 1, that everything will be back to normal by any stretch, but certainly that's the end of the current executive order. So we'll continue to watch that date and bring to you as best we can what's going to happen after that. We heard some of that yesterday from the governor. I want to encourage you, if you're hearing this on Facebook, you're probably hearing it recorded, but still I'd like to ask you to check in, tell us who you are and where you're listening from, the name of your company, join the conversation, be a part of this community. If you're listening on live on Zoom, again, we appreciate you watching and hope this is helpful to you. Brian, this is dress up day. Apparently Brian is once again in his car, but he's got his Sunday best on. And we have a guest, and he's going to introduce our
Thanks,
guest.
Rob. Yeah, it's Wednesday, so I actually put work clothes on Wednesday, some semblance of normalcy in all of the rest of this. But I wanted to access to a healthcare perspective that I've been fortunate to be able to listen in on a couple times a week. Bob Riney is the Chief Operating Officer and President of the Henry Ford Health Systems in Southeast Michigan. It's been right in the middle of this healthcare crisis, part of the overall public health crisis with COVID-19, and has just really incredible insight into what has happened. And the reason why I think this is important for our members, small businesses, to know is because the healthcare outcomes are and will in the future be very, very tied to what the economic permissions are. These things are going to be very, very closely related. So we're going to be following these health outcomes and to understand what is needed for us to be a part, us in terms of the small business community, to be a part of preventing the spread of COVID-19 as we ease into more economic activities. So let me pass it over to Bob. Bob, thank you so much for joining us today, and please take it away.
My pleasure, Brian, and good afternoon to everybody. And let me just start off by thanking all of you, because small business is really the crux of our economy. It has been and it will be moving forward, and we have to find ways to support each other as we get through this really unprecedented time. But just to give you a little flavor from our perspective, we saw this surge coming in Southeast Michigan, and we were faced, as has been, well addressed, with a real shortage, underprepared in the area of PPE, and certainly a shortage of talent to deal with the complexity of the cases that were coming in. And one thing I would tell all of you is you should be incredibly proud of your healthcare workers in the state. They have served you proud, and they have done just heroic things and continue to do so. But we have been in Southeast Michigan for about the last 7 nights at what looks like a plateau in terms of the inpatient cases presenting to all of the health systems. And we've started to see a decline in everyday admissions for COVID positive patients. And so, we plateaued and are perhaps starting a small descent, which is great news. And it also in many ways validates the power of the social distancing that we've all been dealing with. What I would share with you is that the acuity level, or the severity of illness of patients that are presenting today, still remains very, very sobering. So while we are seeing less numbers, we are seeing patients that are very, very ill, and oftentimes showing up now in our ERs where they require immediate ventilator use, or immediate transfer to an ICU. There's a number of reasons we think that shift has taken place. The numbers are lower because of social distancing, but the acuity level may be higher because people are staying home until they are very, very, very ill, because there's fear and there's anxiety of kind of being in a hospital and hearing and reading about the number of patients on ventilators, et cetera. And so in some cases, they are actually presenting later than we would ideally hope they would. And then the second thing that we're seeing is in areas where social distancing is very difficult, we continue to see, unfortunately, a fair amount of patients. And those are in some of the places that you would suspect: nursing homes, skilled nursing facilities, assisted living. We're seeing some in prison populations, et cetera. Just places where social distancing is very difficult, including in large numbers of people living in tight quarters. So, it just really reinforces all these theories behind the social distancing and the power of it. But the overall good news is the numbers are starting to trend down. When you get outside of Southeast Michigan, it's an interesting story because there is clearly COVID activity, and there's been an increase in the number of positive COVID patients in many of the other regions of the state in the last 3 or 4 days. More testing is starting to become available, and so we're starting to get a bigger picture. But probably the most promising news is the number of those patients that are sick enough that they require hospitalization doesn't appear to be growing at any exponential rate. Now, there's exceptions in certain markets, so I'm making a statement that applies overall to the whole state. And again, that could mean that there's just not sufficient numbers. It could mean that the virus is changing in complexity, which will happen sometimes. It could also mean that some of the underlying health conditions aren't as present in certain markets than others. There's a whole host of reasons, but the numbers staying relatively small does suggest that, again, we've had success in communities taking it seriously and doing what they need to do to make sure that we're protecting ourselves and not allowing the virus an opportunity to spread any more than it's already found ways to do. So I would say overall the state's doing very good in that regard. All this is important news from a predictive modeling standpoint because we share everyone's desire to get the economy reopened as effectively and efficiently as we can. But I think we all know that if we're not very methodical about that and we're not careful about that, we could have a return to the kind of surge numbers that we were seeing, or surge in communities that have otherwise been successful at eliminating that. And so, we're working with, healthcare is working with all the various industries and associations around helping assess the new world. And does the new world involve temperature screenings for employees? Does it involve physical design changes in environments? Does it involve behavioral changes and expectations? And, there's a whole host of things that I know your organization is also working on as it applies to small business. And this is going to be really, really important because we want to make sure that we're doing this in a smart way. And I'm confident that we will. I'd also like to mention that the PPE issues, or the shortages of PPE that have become so famous, has been initially an incredible threat, but I think it also provides an opportunity, because one of the things that is very clear is that PPE is going to be a much more normalized part of our lives than we have ever known it to be. And so, all industries are going to take a look at PPE, and even individuals are going to look at PPE as it relates to masks and things when we're in everything from high influenza season to what we're dealing with now. Well, almost all of that is currently offshored. And there's an opportunity from a business standpoint to really look at how we become the center of production of something that we're going to need in much, much greater numbers. The other thing I would just mention, I'm ripping through some things quickly, is that you might find it odd that healthcare on one hand is beyond busy, and we got heroes working like crazy on behalf of our communities. And on the other hand, we are hemorrhaging financially as much as any other industry. And that's because over 50% of the revenue that healthcare systems has comes in the forms of elective surgeries, and other activities. And all of that is, predominantly at a screeching halt. And so healthcare systems, like many other businesses, are seeing a 50% drop in revenue and a prolonged period of that. So when you read about the layoffs and the furloughs in healthcare, it's important to understand that part of it is busier than it's ever been, and part of it is idled. And we're having to be responsive to that, really kind of strange situation for us. I would also tell you that healthcare is going to emerge differently. Telehealth and using virtual means to provide health was something we were moving incrementally. And boy, in this last 5-6 weeks, we have soared in our ability to connect with people through virtual means for just kind of routine touch bases and routine evaluations. And I think you're going to see that continuing in a very, very significant way. And then the last comment I will make is on testing, because there's been a lot of discussion about testing. And there's no question that we have not been able to test the percentage of the population that we need to really get an understanding of how active is this virus and how is it manifesting itself. And so we're starting to get more and more testing done throughout the state as supplies become available, et cetera. And I think that's going to be really important, not just for this current pandemic, but if we see any kind of return. The second part of testing is serology testing, which is really not to test whether you're active today, but whether you have been exposed in the past and you have antibodies that have built up to help. And there's a term called herd mentality. And it's really important because if we find out that we have a certain percentage of the population that has, it's going to really also be incredibly helpful. A lot going on. In many ways, I've been in healthcare 40 years. I've never been more proud of the quality of work and the character of the individuals in the industry. So I'll stop there and happy to take a couple of questions.
Thanks, Bob. I really appreciate your time, but we'll just keep it to one because I know you're about out of time. But I wonder if you could give us a sense now. I saw where Henry Ford is actually getting back into some of those other types of procedures and the regular business of healthcare. And I just wondered, that's something I think our people are really going to potentially connect with, that decision-making process. What steps have you taken to go beyond COVID-19 care and in the emergent care in your preparation to kind of get back into whatever the new normal is going to look like?
It's a great question, Brian. And first of all, we're obviously making sure that everything we do is in full compliance with the state requirements. And so what we've begun to do is, create clean corridors, corridors and areas that are completely free of any patients that have the COVID virus, and then begin to re-enter what we're calling really essential surgeries. Because keep in mind, there are a lot of things that have been put on hold that are really pressing and very important healthcare issues and needs for individuals. So we're starting with those very, very essential services. And then as we're able to expand as we get back to the new normal, as you described it, we'll get back to those next levels of elective surgeries, which are about quality of life, about relieving pain, but they're not essential in terms of life and death. So we're very thoughtful in cascading that. But I will say one other thing that your question triggered, and that's you're going to start to see us in the healthcare industry pandemic is that people have developed a fear of not wanting to contact it. And so they are oftentimes now showing up in our emergency rooms with symptoms of other things at a very late stage, where it's very, very difficult to provide the kind of care that they need. So for an example, finding out stories of someone that's been in acute cardiac distress for hours and hours, but their family could not get them to go to an ER because they were fearful of COVID. And then by the time they show up in that ER, of course, the likelihood of a positive outcome becomes much smaller. And so the messaging of all of this becomes really important, because people cannot fear COVID so much that they are putting other very, very serious circumstances on a holding pattern. And we've got to get that message out.
Well, Bob, we really hope that you would express our appreciation for all the people that are doing outstanding work there at Henry Ford. There's so much more that we could talk about. You guys are doing the trials on hydroxychloroquine, and also just leaders in this overall surveillance and the outcomes, and just terrific work. And we're fortunate to have Henry Ford here in our state. So thanks for joining us.
Thank you all very much.
Thanks, Bob. Brian, let's talk a little bit about yesterday's briefing with the governor, and we've had a little time to think about it and unpack it. It seems like she was, in fact, messaging some things that are going to be important, to answering the question, when and how do we come out of this? And so what was your take on what's important for our members to hear from what she said yesterday?
Well, the first thing is, I thought she wanted to make it really clear that May 1st is not going to look like March 9th, which is right when the first, the day before, I think, the first tests were confirmed. And so we know that there's going to be a gradual process. It should not be a surprise to anyone. In fact, I think that this next generation, it's going to have plenty of restrictions in it, and in conditions on certain new things. But the things that we did hear, new economic activities. So things that we did hear, though, that give us some insight into where things are going in the future, had to do with the example that the governor gave with respect to indoor versus outdoor. What that might sounded like just kind of a throwaway example, or just a little example, but what that says is that she's thinking in terms of inherent risks in certain jobs. And we've been saying this for a while, along with the greater business community, is that there are certain jobs that inherently carry much less risk. And the idea of letting those go, letting those proceed, has a lot of merit to it, especially when we're in an environment where we're seeing stable, plateaued, or even declining infection rates. The other thing was with respect to personal protective equipment. We have been very concerned about sourcing PPE for non-healthcare needs, and to the extent that these things are required, we want to make sure that small businesses have the ability to get what they need in order to meet the requirements of the government. The idea of competing with the healthcare industry is not something that anybody would want to happen. The healthcare industry wouldn't want that to happen. We don't want that to happen. So, but the governor used the term cloth face covering, and that's an important word. What that tells me is, first of all, she's been talking to OSHA. This is the Occupational Health Standards, the agency, my OSHA and state government. It's the agency that does workplace safety monitoring and enforcement, and they use the term in their regulations, face covering, not face mask. Face mask and 95 mask, that's a healthcare term. Face covering is an occupational safety term, and so the idea of securing that type of PPE, while still not going to be easy, it's possible, it's doable, and so that's those are the sorts of things that I was really listening intently for, and give us some insight of the direction they want to go. But I still think that we're the governor clarified later on in another interview last night that things like bowling alleys and movie theaters and nail salons and tattoo parlors, those types of intensely public-facing lines of business would likely not be active soon, that those would be on the later stages of re-engaging the economy. So that was some insight that it's not going to be everybody on May 1st. It's going to be those less risky. Of course, we want to see the updated CISA list, the Homeland Security list, referenced that has a lot of construction activities that could happen in it, and obviously the outdoor types of positions, and the internal stuff, the production capacity where you can achieve social distancing, re-engineering of processes to achieve distancing. These things can be done, and we're hopeful that that's the type of executive order that we are going to see going into May.
Yeah, it's always interesting to listen to what she didn't say too, and I think there are people who are fearful that we're going to just take the place we are and extend it out into May. And she did not say that, nor did she suggest that that's it. It really, the language is all about the next phase. And while we don't have clarity around what that next phase is going to look like, I think it is pretty clear that starting May 1, we're going to be entering a phasing back of the economy kind of scenario rather than continuing the complete shelter in place that we're in today.
Yeah, and she also, remember when we asked if about timing, are we going to know ahead of May 1st? And if there weren't going to be changes after May 1st, then there would be nothing to announce ahead of time. And she said that there would be. She was by the 28th, I think, was ahead of the 28th is when they were looking to put information out. But of course, that puts us in a position where that's not a lot of time between. It's better than hearing on May 1st, but there's a lot of work that businesses are going to have to do. And that's why we're going to start this conversation right now about how we're going to try to help facilitate that even ahead of knowing the particulars of the governor's order.
Well, and that, thank you, Brian, because that's exactly where we are as an organization. I think it's important to understand. I've been counting this thing down. So it's 8 days until May 1. And while the governor said yesterday, we'll let you know ahead of time, it's already late in the game if it's about being prepared to open back up. So what we are doing is we are composing what I will call a restart playbook. And it's taking the best information that we can gather. It's listening to what we're hearing from the Michigan Economic Recovery Council, from the governor, watching what's happening in other states. And I think we can surmise there are going to be some things that you have to pay attention to, and we're going to put it into a playbook and get it out to our members. Our hope is by the end of this week. But here are some of the issues that we know are going to be in it. Distancing. What does distancing look like inside of your company? How do you work and stay 6 feet away from each other? Whether you're an office or a manufacturing plant, how do you achieve distancing? A second is PPE, or personal protective equipment. This thing that we've been talking about. I have my mask. This is not an N95. It is not surgical quality. This is just keeping me from coughing on someone, and that really is what we're looking at PPE wise. And we'll talk about that in a second. So you have to start thinking about personal protective equipment inside of your business. Health screening, the questions you would ask somebody as they come to work, or who's going to ask it, what are the questions? We're going to try to help you with that. But in the meantime, you can go to your county health department and see if they have any of those health screening surveys. The fourth thing is surface cleaning. How are you going to get to the places where people commonly congregate and touch? And what is your process going to be for regularly cleaning those? Common space. Do you have a break room? Do you have a cafeteria? Do you have a vending machine or something where people commonly congregate? What are you going to do with that common space? Our sense is for a while, you may want to close it down. Queuing, if you have customers that stand in line in any way in your business, how do you keep them 6 feet apart? Cash transactions or credit card transactions where people are exchanging things. These are all things you can begin to think about, and we are going to begin to give you some guidance by the end of this week. We're not waiting until May 1st. The second thing we're doing is trying to be helpful in this area of personal protective equipment. Where can you get it? We know that we don't want to be competing with hospitals. This is not a hospital grade mask, and that's important because we don't want to be competing with hospitals for personal protective equipment. And yet, going to be necessary to have some, to provide personal protective equipment, then how can you get it? So we've got a project working. I'm going to ask Scott Lyon to talk about that a little bit, to help gather PPE from Michigan small businesses and provide it for Michigan small businesses. Scott.
So you're right, Rob. What we don't know is a lot right now. We don't know exactly what the work order, get back to work order will look like. But we do know that in order to get back open, you have to be ready to get back open. So we're looking at both the manufacturing and distribution side of this equation. So what products might be available? What do small businesses need to get back open? So the manufacturing and distributing side of it, I would ask the members to let us know what you have and let us know where our members can get it. So we have ramped up a request. It's on our website. You can go there. There are a series of questions that you answer. Who are you? What do you do? What product do you have? Things like that. So that's the manufacturing or distribution side of it. For our members, we're looking to help them source that product, of course. So, we've touched on a few of them today, but I want to give the members some idea of what we're thinking about when we say personal protective equipment. We're looking at sanitizer, both hand sanitizer and something that you could use on your equipment or other surfaces, whether it be a desktop or a water faucet or a coffee machine or whatever people touch, the doorknobs, the elevator buttons, things like that. We're talking about face coverings, of course, cloth or surgical, not necessarily the N95 mask that you see. We're looking at gloves. We're looking at face shields. We're looking at gowns maybe for some industries and other cleaning supplies. So I would say to our members, to the folks that are listening, start thinking about what you need in your company to get those doors back open. Think about other things too, like tape or roping off areas or barriers. As Rob said, you might have to have customers, if you have a counter, you're a restaurant or a hardware store or something like that that deals with the public, you might have to rope off every 6 feet so that people can be socially distanced from one another. Do you have the supplies to be able to do that? Back to the manufacturing side of this, if you're going to send us information that you have product available, think about right sizing it for the average small business owner. Quantities of 10, 20, 30,000, not super helpful to a company with 5 or 10 employees. So think about, can your supply be broken down in increments that are right for the average small business in your community or across Michigan? And last but not least, think about screening the employees. There very well may be a requirement that the employees self-certify that they don't have a temperature now, that they haven't come in contact with someone that has a temperature, on and on. So how do you do that in your environment? Can you do that by paper? Can you do that by a text message that goes out from management team or an email or something like that? But start thinking about those things. We'll think about the equipment, the personal protective equipment, and marrying the distributors and the purchasers. You think about how and what you need to get back open.
So our effort will be to have a landing page on our website where you can go and find personal protective equipment, transparency in pricing, some vetting that we will do, making sure that people who say they're providing it can actually provide it, encouraging them to right size it and to package it up appropriately to small business. So thank you, Scott, for that effort. I think mainly our point is we are trying to activate our efforts as an organization to make sure that we're serving our members as well. So we're not waiting. Last thing I want to talk about, Brian, is the PPP. We find ourselves PPE, PPP, the Paycheck Protection Program. The Senate did some work on it last night. This is the second tranche of funding that we hope to see coming. What's the latest on that?
Well, we expect to see action in the House tomorrow, probably tomorrow morning. They're going to go into session at 10 a.m. And it looks like it's a go. The deal was worked out over on the Senate side, passed last night. So it shouldn't. Hopefully, there's no drama, and it'll make it to the president. And he'll sign it straight away. So it's going to be important that you are in line already on this. Pretty much all the banks are up and running now. Even the ones that really struggled before say they're ready. So I would just encourage you to, if you're in line, check again with your loan officer. Hey, you got my application? Put them on the spot. Have you looked at it? Have you verified you have every single thing that you need, that you're not going to look at it and then have to set it aside and go back and get extra information later on? They know the rules. They've all processed a bunch of these things now. So they should be able to tell you, yep, I've looked at it. Everything's all set. We just need to submit it as soon as that portal is back open, because that portal will be open very quickly after the president's signature, which I kind of expect is going to happen tomorrow. I think they'll pass it, and I think they'll deliver it right over to the White House, and the president's going to sign it. So it's go time, and so I make sure that you don't miss this second round, because like we said before, we think there's going to be other kind of stimulus packages in the future, but the idea of running an in-between one like this is probably to put more in the PPP is probably not likely. If there's more to come in this area, it's probably going to be with the next big stimulus package, which is not just around the corner.
Yeah. All right. Well, thank you for that update. We're taking side bets on whether the SBA site crashes on Friday. I'm betting it does, hoping it doesn't. But to your point, it's going to be there's going to be a rush, and another $300 billion could go pretty quickly. So, part of what we're really trying to do is, I would say to you, if you know any business who hasn't heard of the PPP or doesn't know about the PPP, you should call them tonight, and encourage them to take a look at it. There are some people who are just not paying attention, or stubborn, or suspicious, and I get all that. But this is a once, and if you choose to not do it, you should at least understand your competitors are probably going to be taking advantage of it. And so we're just trying to encourage as many companies in Michigan as possible to take advantage of this, and make sure that Michigan is well served here. Well, that's all we have for today. I do want to preview a little bit for tomorrow. We have another guest. Her name is Sheryl Sandberg. She is the COO of Facebook, and she's actually kind of a big deal. If you don't know about Sheryl Sandberg, Sheryl with an SH, you might want to Google her in the meantime, and she's going to spend a little time with us tomorrow. Facebook is doing some cool things, and she'll talk about that. So thanks for joining us today. Stay safe, and remember to wash your hands.
And don't touch your face. We'll see you tomorrow.